Swadika. Good afternoon. Welcome you all to Pre-Connect by Pet Fair Southeast Asia and the first FAVA webinar in 2022 on veterinary telemedicine in ASEAN, challenge and opportunity. My name is Professor Dr. Achariya Sailasuta, Director of the Federation of Asian Veterinary Association, FAVA Office, Bangkok, and Chair of the ASEAN Veterinary Statutory Body Network, AVSBN. It is my pleasure to be your moderator for this truly exciting next hours of thought leadership on veterinary practice. I would like to take this opportunity to express my sincerest thanks to you for the good collaborations among FAWA and the Pet Fair Southeast Asia team from VNU's Exhibitions Asia Pacific to jointly organize this webinar today. As the name of Pre-Connect always states, what is Pre-Connect? This event is all about pre-connecting and pre-meeting before the upcoming in-person trade show this year. Pet Fair Southeast Asia will take place from October 26 to 28, 2022. We, FAWA, are cordially inviting the International Veterinary Committee to come to Bangkok this October for Pet Fair Southeast Asia. The COVID-19 pandemic has affected the world and the impact of it on the veterinary profession has been sudden, far-reaching, and varied. Therefore, today, FAWA is very proud and honored to be able to present about challenge and opportunity of the veterinary telemedicine on now in ASEAN that can potentially provide benefits to animal welfare, reduce costs, and ease of service where owners cannot travel, likely the social distancing during the pandemic as well. To address the important topic, we have united today a very esteemed panelists who will be all with us sharing their knowledge and thought leadership. To all attendees who have questions to one of our speakers, I would like to encourage you to use the Q&A box on the bottom navigation bar. We will address all questions submitted via the Q&A after the speaker presentations. Please note that a certificate of attending this webinar will be provided to the attendees who are online for more than 80% of this session. Yes, it's time. And now we are going to start the webinar. I would like to invite Dr. Quaza Nizammuddin bin Hassan Nizam, FAVA President, to deliver the opening address. Please welcome Dr. Quaza.
Thank you for the kind introduction, Professor Dr. Achariya Sailasuta. Hello everyone, warm welcome from me at FAWA to all participants who are joining this latest webinar entitled Veterinary Telemedicine in ASEAN, Challenges and Opportunities. This webinar is jointly organized by FAWA, VNU Asia Pacific, and Pre-Connect by Pet Fair. Ladies and gentlemen, today we will have three distinguished speakers, that is Professor Dr. Kaywalee Chatdarong, Chair, College of Veterinary Specialists of Thailand, Dr. Teo Boon Han, Honorary Secretary, Singapore Veterinary Association, and Dr. Amilan Sivagurunathan, Director, Consultant, Ophthalmologist, Animal Medical Center, Malaysia, who will share their insights on veterinary telemedicine. Ladies and gentlemen, FAWA, or Federation of Asian Veterinary Association, is a 27-member association from various countries in the Asia-Oceania region with an outreach of more than 100,000 veterinarians. FAVA plays an important role in working with national veterinary associations to carry out programs, projects, and activities to benefit member associations. This is one such program. Ladies and gentlemen, as we already know, telemedicine has been used in one form or another in the past. It is an approach used to further improve the manner in which veterinary services are being delivered. In addition, we will be able to derive benefits through enhanced veterinary medical care for patients, and this in turn will result in better client relationships. In the current context, various terms are being bandied about, that is, telehealth, telemedicine, teleconsult, teleadvice, telemonitoring, teletriage, and telesupervision. Telemedicine would form part of telehealth. There are very many advantages of telehealth. These include information sharing and education, after hours care, assessing patient or AI based diagnostics, monitoring patient progress, client compliance, and palliative care, among others. I'll let the speakers deliberate on this and the various approaches. I'm sure we can learn quite a lot from this engagement. Ladies and gentlemen, COVID-19 has taken toll on all of us. To advance knowledge and share experiences, we at FAWA are creating the right content and topics of interest to present it to members. We have also undertaken to work on the FAWA strategic plan, which covers the 6 pillars of importance. They are one, health, veterinary education, pharmaceutical stewardship, animal welfare, food security and safety, and internal and collaboration. Implementation plans have been outlined, and with support of members, we will strive to deliver on key deliverables through the various FAWA Standing Committee which have been appointed. We hope to assist in improving the veterinary services in member countries. Ladies and gentlemen, we're also finalizing the FAWA Antimicrobial Resistance Strategy 2021-2025, which focuses on the various activities to empowering veterinarians in Asia towards fulfilling their roles on the Global Action Plan on Antimicrobial Resistance. The FAWA AMR Strategy 2021 to 2025 serves as a tool to guide, encourage, and support public and private veterinarians in taking proactive roles to contribute to AMR mitigation in their countries and in the broader region. It also outlines the planned actions by FAWA to help create a reinforcing environment for veterinary professionals and the national veterinary associations as a collective regional contribution to the overarching global action plan on AMR. We hope members will participate actively. Ladies and gentlemen, finally, I would like to thank Professor Dr. Achariya, Sailasuta, the speakers, VNU Asia Pacific, and Pet Connect by Pet Fair, and most of all to all participants present here today. I wish you all a successful webinar. Stay safe, stay healthy. Thank you.
Thank you very much, Dr. Quaza Nizammuddin bin Hassan Nizam, FAWA President, for the warm welcome speech. Allow me to introduce our invited speaker today, Professor Dr. Kaywalee Chatdarong, Chair of College of Veterinary Specialists of Thailand, Veterinary Council of Thailand. Dr. Kaywalee received her DVM from Chulalongkorn University and accomplished her MSc and PhD at Swedish University of Agricultural Science. She has been awarded a diplomate, founder of Thai Board of Teleogenology in 2016. Apart from her presence in the Veterinary Society, she involved in hospital management as the director of Faculty of Animal Teaching Hospital during 2013 to 2016. Nonetheless, she is also actively doing research and teaching DVM and postgrad students. at the Faculty of Veterinary Science, Chulalongkorn University, Bangkok, Thailand. She will share us the establishment of the veterinary telemedicine in Thailand. Yes, next. Our next speaker is the second speaker is Dr. Teo Boon Han, a managing partner and veterinary consultant of VetTrust Singapore, and is the current honorary secretary of the Singapore Veterinary Association and secretary of the FAVA Veterinary Education Subcommittee. Dr. Teo finished his Bachelor of Veterinary Medicine from the Royal Veterinary College in London, and now he is a member of the Royal College of Veterinary Surgeons. Dr. Teo was also Singapore representative to the ASEAN Veterinary Statutory Body Network and representative to OIE for rabies and veterinary-related matters. He currently sits in the Singapore Workplace Safety and Health Council Healthcare Committee and is the co-chair of the Antimicrobial Prudent Use Guidelines Working Group by the AVSBN. He is also part of the team to set up Vet Compass in Singapore in collaboration with the Royal Veterinary College. He will share us in the topic of an evaluation framework for veterinary telehealth. And last but not least, our last speaker is Dr. Amilan Sivagurunathan, representative from Malaysian Veterinary Medical Association, MAVMA, Malaysia. Dr. Amilan graduated in honors from the University Pretoria, South Africa. In the following years, he was appointed as head of clinical operation of MediVet Group and is currently the director of Animal Medical Center. He opened the first specialist and referral ophthalmology service in Southeast Asia in 2010. Dr. Amilan served as the president of Malaysian Small Animal Veterinary Association during 2015 to 2017 and was reappointed as a president in 2021. He is also a member of the Animal Welfare Consultative Committee since 2017 and in 2018 was awarded by Wasawa the Meritorious Service Award for his contribution to his profession locally and regionally. He will share us in the topic of the challenge and opportunities of veterinary medicine in Malaysia. Yes, all of our invited speakers today are with us right now. So please welcome our first speaker, Professor Dr. Kaywalee Chatdarong. She will share us on the topic of establishment of veterinary telemedicine in Thailand. Yes, Professor Kaywalee, the floor is yours, please.
Okay, thank you very much for your introduction. It is an honor to be a part of this special event. I will start my talk today with the difference of two terminologies, telehealth and telemedicine. I would like also to share the idea of using telehealth as a potential teaching tool for veterinary students. I will also share how telemedicine was established in Thailand. Lastly, the opportunities and the challenges will be discussed. As we know, in the past decade, WHO defined telecommunication technologies used to provide care and services at a distance as telehealth and telemedicine, and it said both terminologies are interchangeable. But however, nowadays, many organizations recently define telehealth being the broader scope of remote healthcare service. At the same time, telemedicine is already a subset of telehealth, which uses technology to deliver clinical services to a remote patient. The difference is that telemedicine requires it's just simple. The difference thing is that telemedicine requires licensed physicians who are eligible to prescribe medicine. For us, this is the difference between telehealth and telemedicine. I have to say that the establishment of telemedicine in Thailand is very early. The announcement by law was just done in September last year. So there's still confusion between telemedicine and telehealth and how to differentiate them. This is the concern of what we have to do and educate people in Thailand. Based on the American Veterinary Medical Association, the definition of telemedicine is a subcategory of telehealth that involves the digital exchange of information from a distance regarding a patient's clinical health status within an existing, this is the stress, within an existing veterinarian client-patient relationship, and the short term is VCPR. So we talk about VCPR very much. It is not all the veterinarian can do or can provide the telemedicine services, but it must be work under the hospital and under the veterinarian client-patient relationship, which is called VCPR in short. As I am a lecturer at the veterinary school, I can see the opportunity. I can clearly see the pain points of the student learning, why we put the concept anywhere can learn. Do we provide accessibility of clinical cases sufficiently for the students to learn, particularly during the pandemic? This is a question, and we all know we have done the best, but we can do the better. I'm sure as a veterinarian, we can do better for the world, for the country, and for our future veterinarians as well. However, this pandemic is like a shot in the arm to drive veterinary schools around the world to prepare a new way of teaching. Is it time to move on using digital technology like video conference to bridge the students and animals both in the clinics and on farms? Iowa State University has recently demonstrated a successful proof of concept test to learn how to draw blood from a pig while receiving instruction from a remote veterinarian via telehealth platform. In livestock farms, using video conference as a means to conduct animal examination, telehealth is a method reinforcing biosecurity while allowing students to approach cases virtually instead of the visit at farm. So why not? And telehealth is a future. It is the way, new way of teaching, and we all have to accept that to improve this platform, we have to go through we have to agree on the standard of care, which is the utmost objective. I mean, standard of care to the animals is our utmost objective. So not only human but also animals who attain the advantages of telehealth. In clinic visits, dogs and cats are less afraid compared with what is typically for them during an in-clinic appointment. So telehealth and telemedicine is the future of teaching, being worth investing to improve the clinical skills of the veterinary students. According to the animal welfare policy, there is a shortage of of animal uses for teaching. Isn't it wonderful to use the limited animal resources to teach students as many as possible? Is it time to share resources among universities in the country, in the region, and even in the world to uplift our future veterinarians and the profession? Using telehealth platforms, students can learn history taking either via video conference or just the Line application in which we in Thailand is familiar with. By the way, the awareness is to manage properly the disclosed information and arrange the access authority which are not above the digital technology nowadays to cope with. I am sure that both of the services have arisen as one of the greatest opportunities and challenges facing veterinary medicine in this era. Using telemedicine platform, the wearable biosensors is for animal health management is another application for those follow-up cases, for those staying home animals, and for us veterinary who give the remote advice or remote prescription to the animals at home. However, the veterinary service must be provided with professionalism and adhering to the same standard of care, whether delivered in person or through electronic means. And because the standard of care for animals is the utmost important, the establishment of telemedicine in Thailand has involved two organizations, the Veterinary Council of Thailand and the Department of Livestock. Similar to the establishment of telemedicine in human doctor, which is the practice guidelines for telemedicine and online clinic was announced by the Medical Council of Thailand, and together with the hospital standards for telemedicine service controlled by the Ministry of Health. The veterinary telemedicine in Thailand was initiated by the approach of technology startup during the COVID pandemic, the COVID-19 pandemic. The process was carried out in three phases. Firstly, a guideline was drafted by the Veterinary Practitioner Association of Thailand with the advice of the Medical Council, who has run this about 1 year before us. The draft was then submitted to the Veterinary Council. Later, the Veterinary Council actively actioned on public hearing in collaboration with VPAT, who having more than 6,000 members practicing in small animals. So within about 160 responses, which is quite low number, but in a short time, we did our best to gather the public hearing in order to launch the announcement by law as soon as possible during the pandemic. And this is for all things that have been done. It has the one objective, which is the standard of care to the animals. So it kind of arrange everything in discipline. There are concerns on the freelances, veterinary freelance, but this has been written in ministerial regulation that the vets must work under the hospitals, and not all the hospital can provide this service. A registration of the hospital must be performed. So some were afraid that physical approach is limited. Vet may not be able to diagnose without physical examination, and this is true. This is very, very, very true. So it written also in the guideline that ethically, the vet has a right to refuse giving this service. Again, the confusion between telehealth and telemedicine has been stated, and I think public education will help solving this misuse, and it would take time. So after that, the first draft was later minorly modified according to the comments from the veterinary community. The establishment was finally announced in September last year under the controls of Veterinary Council and the Ministry of Agriculture and Cooperatives. So it took only 6 months for the whole process. This slide shows the practice guideline for telemedicine and online clinic written by the Medical Council of Thailand. The contents include 9 items. Firstly, the title of guideline is identified as Practice Guideline for Telemedicine and Online Clinic 2020. The validity of the guideline. The definition stating that telemedicine is the connection between physicians and patients via electronics. The service must follow the medical ethics. Both physicians and patients have to understand the technical system and limitation and accept the limitation of the communication via the electronics, and they can both refuse to give or obtain the service if they want. We have to also protect the safety by using IT security, and of course the system, the technology system, the electronic system must provide the identities of physicians, both physicians and patients. And of course, this service must run under hospital medical record, and along with the BCPR that I mentioned earlier. We as medical record has to be still kept and not be handed to along with this is a kind of safety protection, disclose the information. So the 9 item is the communication between physicians is not a telemedicine. I know that in some countries we say the forward to backward. I mean the consulting between physicians is called telemedicine, but in Thailand, communication between physicians is not a telemedicine. And this is the guidelines for telemedicine in veterinary practice, which is announced by the Veterinary Council of Thailand. The announcement was made on September 28, 2021 last year. It's validity 90 days after announcement, which is the guideline gives the definitions of veterinary telemedicine, animal hospital, what is the telemedicine service, what is the telemedicine system. These are to unify the definition of the terminology, so that people and veterinarians will understand the same definitions. The service elements, there are 3 service elements. First is veterinary practice standards, veterinary ethics, and the clinical practice guideline, which still have to follow these 3 elements. The service providers have to know the rules. They have to study essential technical and limitation of the system. They have to accept limitations, updated, and also they have to update knowledge provided by for example, College of Veterinary Specialties under the Veterinary Council. So some but not all clinical services are provided. Veterinarian or client can refuse telemedicine service. AI and technology and electronic tools used must follow related by law. Veterinarian and owner must accept list of information media system, and all the 9 items written in the guideline according to are written according to the medical council. Finally, I can see quite many opportunities on using telemedicine, and for me as a lecturer, I can see the opportunity to implement in veterinary education, to share animal health information which will uplift our knowledge in the veterinary science. It can expand access to veterinary care. Why not advise why the animals not have a right to be advised by specialists from maybe in the region, in other region of the world, and they can also the animal can also given the after hours care, the real-time monitoring, the three-way consultation, which is important. Client, primary veterinary, and the specialist can be in the same page, on the same stage, and give the advice and use the real-time information and record from the animals. The challenges is that artificial intelligence assisted diagnostic must be improved, must be developed, like all those valuable monitoring equipments which can use remotely to the patients. Marketing service and engage clients, and I think the two speakers after me will talk about this quite well because they are in the industry. And the expectation, a backup plan, what is the expectation of the clients to the service? Have we made them to understand the concepts and understand the limitation? Determine a pricing strategy is another challenge, and of course equipment is important. The internet is critical, not in the part of veterinarian, but the patients or the clients, the animal owners have to realize that the connection between vet and owners may be disrupted, but not because of the service, but it's just the equipment, the technical things. So finally, I would like to give the take-home message. Telemedicine has the opportunity, has the advantage in veterinary education, both in livestock and in pet animals. Veterinary medicine in Thailand was learned from human telemedicine. There are some limitations, like clinical examination is essential in veterinary medicine, which is not the same as in medical school or in a human physician. They can give the client, I mean the patient can talk, can speak, can tell about their clinical signs, but dogs and cats and of course the livestock, they cannot tell what's wrong with them. So the owners there are chance that the owners will give wrong information from the animals to us. So this is the limitation of using this technique. Okay. So these are all my presentation, and hopefully the information will be shared, and we can discuss later on to improve using of this platform. As valuable as possible and as beneficial as possible in the future, and hope to have the collaboration between countries in Asia. Thank you very much.
Hi everyone, my name is Dr. Teo Boon Han, and today I'll be sharing on an evaluation framework for veterinary telehealth. Thank you to FAVA and the organizers for having me. Just a little bit about myself. I'm currently a managing partner and veterinary consultant at Vet Trust Singapore, as well as the current honorary secretary of the Singapore Veterinary Association. These are some of my other notable appointments. This is what we will be sharing about today. We'll first give an introduction to evaluation frameworks. We'll talk about what they are, why we might need them, and when we can use them, before going on to sharing about the conceptual evaluation framework, which may be useful for veterinary telehealth. And finally, we will end off with some closing thoughts in the conclusion. So let's begin by first asking ourselves, what is an evaluation framework? An evaluation framework is essentially a tool for us to frame and report on initiatives, programs, or trials in a structured manner. Evaluation frameworks guide us on what will be evaluated and how this evaluation would be conducted. Evaluation frameworks are commonly used in a wide variety of industries and sectors, including the human health space, in the evaluation of social programs, for example, the effectiveness of regulatory policies and training programs, and also evaluating the rollout and adoption of technologies. There are many evaluation frameworks that have been described in literature, and each is useful in a different context. This slide here is an excerpt from a paper published in 2020, providing a compilation of some available frameworks in human health. So why do we need evaluation framework for veterinary telehealth and telemedicine? I think first and foremost, we must recognize that the relationships in our industry is complex, with multiple stakeholder groups and potentially very different perspectives. These stakeholders include the veterinarian as a service provider, the client and patient who we interact with and provide the service to. Regulators are also an important stakeholder, along with the telehealth provider, the clinic practice owners, and also the pet community at large. Veterinary telehealth is also highly scalable, and the potential to affect a large number of individual stakeholders is there. From a macro perspective, putting in place an evaluation framework with clear evaluation criteria and outcomes ensures that we consider the issue holistically, taking into account medical and clinical outcomes at the individual and population level. It also enables us to factor in multidimensional considerations, including psychosocial and societal considerations, including that of the veterinary industry, but also society at large. And we should also keep in mind the impacts to the business landscape of the pet sector. Globally, the stage of evaluation and approach to veterinary telehealth and telemedicine is different in different jurisdictions. And this could be impacted by the COVID-19 situation. In the UK and in some states in the US, these states and countries have put in place and eased restrictions on telemedicine on several occasions recently. Even before COVID, views are often polarized at both the national and community level. For example, pre-COVID, some states in the US have effectively banned telemedicine, while others are conducting trials. In the UK, an RCVS report from 2018 showed exactly how polarizing the topic could be. For example, if we look on the slide here, this was an excerpt from the report itself, When asked if remote examination should be allowed to take the place of a physical examination in some circumstances, so not all circumstances, but only some, 41% of respondents said yes, while 40% said no. 19%, which is a significant proportion, are on the fence and gave the reply as not sure. From the same report, respondents were given different broad scenarios and asked if they would consider using the telemedicine technology in these circumstances. And these are the results. An important takeaway that I have from these two slides are these, that the framing and context is actually very important when it comes to evaluating the use case of veterinary telehealth services, and that respondents could give very different answers when the questions and scenarios are presented differently. So just as an example, if we look at the previous slide, we saw how about 40% of the respondents said that we should not use telehealth medicine or replace a physical examination with a virtual one. But over here, when presented with a routine and non-emergency cases, the positive response rates went up to 60%. And for out-of-hours periods, it actually went up all the way to almost 70%. So the framing of the question and the context is actually really important. And that's something we have to grapple with if we are conducting consultations. Regardless of which camp respondents belong in, there's something that is quite clear, okay, is that many are seeking clarification and directions on the matter. And given how polarizing it appears to be, we need to try to bridge the opposite camps. Okay, and as we touched on a bit earlier, different countries and jurisdictions are at different stages of the discussion on the matter. Some, like me in Singapore, we are in the early stages of discussion, where other countries are in the consultation or trial phases already. Some other countries and jurisdictions have made it law or developed guidelines for telemedicine. But regardless of whichever stage that a country or jurisdiction is at on the subject, a robust evaluation framework is important, as it will serve as a starting point to bring together inputs and opinions from regulators, practitioners, industry, academia, and pet owners. So all the relevant stakeholders. The framework would also be a basis to support decision-making by promoting perspective-taking, okay, from the different stakeholders, promote a general understanding and also resolving differences in views. The framework will also allow a structured approach to the evaluation of the subject as a whole. So this framework can be very useful and applied regardless of where a country is at when it comes to the discussion on the subject. Like I mentioned before, in Singapore, we are very early stages of understanding the landscape a little bit better. And perhaps the framework could be useful to help us frame the issues that are at hand. Okay, this framework could also be applied to countries that are planning or have started a consultation or trials with the various stakeholders, as this can help with the scoping and design of the consultation or the trial itself. For countries that are further down the road on the subject, the framework could be a useful tool to guide and prioritize implementation. And even for countries that have rolled out laws or guidelines, the framework could be useful for monitoring processes and outcomes post-implementation. Okay, when it comes to developing a framework for veterinary telehealth and telemedicine, the good news is that we do not have to reinvent the wheel, nor do we need to develop an entirely new framework from scratch, as there are many existing human health frameworks out there. In particular, we found the CIRO's framework of evaluating telehealth programs very useful and comprehensive, as it introduces the socioeconomic criteria of evaluation. It also speaks to the health domains that are available, health services that I mentioned, and the context of the delivery of the telehealth services. The framework is very useful in helping us describe the telehealth initiatives and in the framing of telehealth programs. For example, we could use this framework to generate a telehealth program scenario for discussion, such as, for example, in human medicine, we can speak to pediatrics, perhaps using it to diagnose colic using real-time video services in rural areas. Okay. And from there, the associated socioeconomic outcomes could be assessed. Or perhaps another example in human health would be treating clinical depression by a real-time video in an urban setting for the health domain of mental health. So it really helps us scope and frame the discussion a little bit better. For veterinary telehealth and telemedicine, so what we've done is adopted the zero framework, but layered upon it a few other dimensions. For example, for us, the animal type is actually really important, and I'll go into these in the next slides. Okay. Other than animal type and animal users, okay, that has been layered on the previous zero framework, client factors are actually also really important for veterinary telehealth and telemedicine that we do not see as much in human medicine. Okay, for the most part, the rest of the dimensions would still apply to different extents compared with human health. Additional considerations in the veterinary space, which I felt was quite important personally, is the classification of the animal type, which is the additional layer that we've added upon. The risk tolerance and considerations between pets, farm animals, and wildlife are very different. For example, food safety considerations must be factored in for food animals, while perhaps conservation efforts may be factored in for wildlife. So that's why we added on that extra layer for animal type. Another additional dimension to consider for the veterinary industry is client factors, because as we all know, a key difference between human and veterinary medicine is that the client often serves as an intermediary between us and our pet patients. We may want to factor it in as an assessment about the client, such as their understanding of the animal and ability to interpret their pet's condition as an additional dimension. The expectations of an experienced and knowledgeable farmer, for example, is likely to be different with that from a first-time pet owner. Under the outcomes, added considerations include the stress of animals leaving the home, which is perhaps something our human health colleagues may not need to deal with as much, okay? And also the long-term implications to alleviate manpower issues. One issue that is in discussion, at least in Singapore, is that a potential barrier to entry and application of veterinary telehealth is actually the ability to verify ownership of the animal and the authority to consent, which our human health colleagues are unlikely to grapple it less with these issues less. Okay, so let us use this modified framework and apply it to a scenario. So I've taken this excerpt, the one that we see on the slide from the AVMA website, which describes the lack of access to veterinary services in rural communities. And this potentially leads to public health food supply issues, economic and financial losses to farmers, and poor animal health and welfare. Let's try to use this framework as a basis for discussion, for the use case of veterinary health services for this scenario. Okay. So using this example and applying the framework, seeing the framework in action for this. So we can scope this discussion using the framework for this example. We can scope this discussion using telehealth services for diagnosis and advice for cattle in rural communities, using real-time video and stored media. For example, just a simple FaceTime or Zoom call. Okay. When evaluating the socio-economic outcomes, the cost of implementation is relatively low, assuming that the IT and CT infrastructure are in place, CT meaning communicative technologies. Okay. In terms of benefits, we expect an increased accessibility of these farmers and the rural community to veterinary services. Okay. Other benefits include early detection of disease, which is actually very important in contagious diseases. The reduced stress from transport of the animals is also an important benefit. And in addition, in the medium term, veterinarians who may otherwise leave the field due to personal commitments such as long hours and demands may be more willing to provide these services from the comfort of their own home. That is also a benefit. So based on my experience, many vets in both companion and farm animal sectors compare the service provided by veterinary telehealth. They often compare that to the gold standard, and rightly so. This is in accordance with what we have been trained to do in our veterinary education. So for example, using this case as an example, many veterinarians will agree that using veterinary telehealth to come up with a presumptive diagnosis and to provide advice can never be compared to an in-person visit by a veterinarian on the farm and a sample collection and subsequent laboratory diagnosis as soon as possible. Now, these veterinarians, we may be tempted to speak out against telehealth services in such cases after we compare with the gold standard. However, we must bear in mind that in reality, we really need to consider and compare with what we call the next best alternative instead of comparing to the gold standard. So if this case, this particular case of a rural farm, okay, if this case were a contagious disease situation, and if the telehealth services were not provided, chances are that the disease would remain undetected for a little while longer. Okay, and we're making containment a little bit harder down the road. So in conclusion, just to end off, this is my last slide, okay, before references. Just want to mention a few things about the framework. There's a lot more to be discussed, of course. What's important to understand is that it can be operationally challenging to validate all the dimensions of the framework for all the permutations that are available out there. But how we see it, at least, is really to use this framework more as a tool for prioritization and contextualized for your own needs, as opposed to feeling the need to validate every single permutation that's out there. That will not be feasible. Another closing thought that I'd like to add as well is that this is just from personal experience. I feel that very often consultations are done with the veterinary profession and telehealth service providers and the regulators, but really users' inputs, for example, animal and pet owners, should really be sought as part of this consultation process. And the last closing thought I would like to add is that when preparing for consultation or when responding to consultations, we are often comparing it with the gold standard, but really, in reality, perhaps we should be considering the next best alternative instead. Okay. Now, for other future considerations, this is a really exciting field out there. A few things that might change the landscape a little bit more. So I think pet wearables as part of telehealth and telemedicine is coming up. Globally, the adoption rate seems to be picking up, and there are more and more new technologies out there. Okay. I bracket future because some of these things are already in existence and developing. Okay. One other consideration as well is cross-territory telehealth and telemedicine services. For example, in Singapore and, for example, in Thailand. Were you able in Thailand to consult a veterinarian through telehealth services in Singapore, even though the Singapore veterinarian is not regulated in Thailand or licensed in Thailand? So that is a whole different issue. Other future considerations as well, and current actually, this one is data security, data protection, and server requirements that we should consider and explore imposing on the telehealth providers. I think data, personal data is very important consideration. What's important for the regulators to consider as well is to maintain some parity with the human telehealth and telemedicine policies. So just as an example, there are some jurisdictions that may feel that because pets cannot communicate to the vet directly, and it's through the intermediary, which is the pet owner, that telemedicine should not be allowed and should be banned. But in reality, if that country also has pediatricians that utilize human pediatricians that utilize the telehealth services, the same logic applies to that as well. Okay, so it will not make sense if you ban veterinary telehealth but allow pediatric services using telehealth in human medicine. Okay, so maintaining some parity with a whole of government approach. Okay, and another consideration finally is the storing and ownership of medical records and who actually owns your medical records. I think traditionally, at least in Singapore, medical records are actually owned by the veterinary practice. Okay, and owners can request for a medical report to be written, of course, but really the medical records are owned by the veterinary practice. So if there's a need to review that moving forward, as the regulators and the associations can look into this as well. Okay, thank you. And these are my references. Thank you so much for your time and for FAVA for having me. Thank you.
Hi everyone, my name is Amilan Sivagurunathan and I'll be presenting for the next 20 minutes a perspective of veterinary telemedicine in Malaysia. I would first like to acknowledge the Veterinary Association of Malaysia for inviting me to participate in this topic discussion. I would also like to thank the organizers for FAVA for an interesting lineup of topics, making this conference very relevant with the rapid changes affecting our industry. My perspective of telemedicine comes from my work experiences before and during the pandemic. And as a director of an emergency hospital, there are many challenges we had to address. And I hope to share some of them with you today. The first part of my discussion will be on COVID-19 and how emergency practice has changed. We will then look into the VCPR, or the Veterinary Client Professional Relationship. I will then talk about the regulatory framework that exists in Malaysia. Lastly, we will discuss the challenges and opportunities of telemedicine in Malaysia. After my presentation, we can all choose to agree and disagree that VCPR guidelines are integral for the implementation of telemedicine and telehealth services. The first time telemedicine was implemented in a clinical setting was in 1980 at Animal Medical Center, New York, where ECG readings were sent via the phone electronically between specialist cardiologists at other centers to review and comment. Some may argue that clinical updates or opinions given on the phone may be termed telemedicine. For the next millennium or less, technology innovations are now moving faster than ever. And since the pandemic, it has accelerated. And for the first time, telemedicine was brought to the fore in Malaysia and globally due to a whole host of reasons. For a start, it may be due to the rise in pet care globally, COVID restrictions and exposure risks to the staff and the public, and the reduced accessibility to veterinary services during closures. During the pandemic, the rise in anxiety among the public and the reduced accessibility to veterinary services resulted in frustrated clients and more negative social media comments. This has put an immense pressure on the emergency veterinarians and the healthcare team. And unfortunately, in Malaysia, the regulatory framework was not ready for this. The previous colleagues whom I have spoken today, Professor Dr. Kaywalee and Dr. Teo, have outlined the VCPR. However, I would just like to emphasize 4 main points that to me is important for the establishment of VCPR. Firstly, there has to be quality of care. Secondly, the welfare to the patient. Thirdly, an accuracy of the assessment to ensure that the correct information is replied. And third and fourth, the ease of communication that is facilitated. This little tripod clearly shows you the interactions that are essential in the establishment of veterinary or telehealth services. Firstly, for clients to trust a veterinarian or a service provider, there has to be quality interaction, strong communication, and of course, adequate education and preparedness. This is what clearly envisaged in the practices that were adopted by various countries around the world. In order for the VCPR to take effect, a number of requirements need to be complied with. Most legislations around the world require a bona fide client to establish a VCPR. Telemedicine is no exception. There are, however, exceptions in an emergency setting. The veterinarian must have sufficient knowledge of the patient, so being must have examined the patient prior. This is important. The veterinarian then assumes the responsibility of making clinical judgments regarding the health of the patient and has agreed to follow the veterinarian's instruction. The next point is obviously equally important, whereby complete legible records must be kept. In specific situations like during an emergency disaster situation, the patient in question may refer to more than one patient, one animal. It may also refer to a group of animals. During an emergency setting where we perform triage and sometimes teletriage, we need to take heed that when it comes to the welfare of the pet, it always takes precedence over the need of a bona fide client. In Malaysia, a number of laws have been enacted, starting with the Telemedicine Act in 1997, which was a blueprint to facilitate the implementation of telemedicine in Malaysia, specifically for the medical profession. Unfortunately for the vets, this act does not apply to us. The only act currently in motion in Malaysia is the Vet Surgeons Act 1974, which has wholesome and traditional in spirit, but it may not have all the considerations pertaining to the advancements in the profession. Because of the gaps in Act 1974, two directives were enacted to bridge the divide, of which variation in interpretation, which is the key concept here, has limited the use of telemedicine on a wider scale. Some may argue that social media guidelines limit the use of telemedicine in Malaysia at the present time. Very much another form of variation in interpretation. Another example, of course, is the subsection of infamous conduct in our Veterinary Council guidelines, where telemedicine could be interpreted as sometimes by individuals as online advertising or canvassing. In another subsection, under practice and commercial undertakings, requires veterinarians not to associate himself in commerce in such a way as to influence. Also a subject of interpretation. On a brighter side, we have the new Vet Bill 201X that is in process of dialogue engagements, and we hope that this act will take into consideration the changes affecting the profession and to help us improve the service delivery. So it is clear from my previous slide that in Malaysia we saw more challenges in the implementation of telemedicine than opportunities. However, without appropriate guidance on its use and knowledge on the subject matter, during virtual consultation, misinformation and most importantly polypharmacy could take precedence. There may be a tendency to overprescribe without inspecting the animal first. On a financial standpoint, telemedicine may offer accessible and affordable service to the benefit of our clients. However, the expense of increased staffing and technology investment needs to be considered. At the end of the day, the onus is up to us to rise up to the challenge and to maintain a professional service guided by ethics. As an emergency service, we faced numerous challenges during the pandemic. The surge in cases, in some cases twofold, initially placed a huge burden on emergency services. and unnecessary pressure on the healthcare team. This was primarily due to the reduced consulting hours by the university, private practitioners, and of course, intermittent closure of veterinary services. Despite the limitations in regulation, virtual consults for repeat visits with bona fide clients took precedence in our practice in order to ensure adequate service delivery. Keeping in mind the balance that regulators have to play between ethical accessibility to veterinary services and telemedicine, we can certainly benefit from the global lessons learned from its implementation. Two policies were implemented at our hospital for the emergency service specifically during the pandemic. The first was teletriage, and the second was a congestive heart failure review model. Virtual communication with clients for teletriage only helped when the healthcare respondent had adequate knowledge on the subject matter. This was something we had to find out through the hard way as we implemented teletriage. There were times where we had to deal with incorrect information or misunderstanding of what the client was trying to say, which is why you need a skilled individual to implement teletriage. In the congestive heart failure model, what we have realized that once an initial veterinary visit has established the nature and severity of the disease, telemedicine allowed for an ease in the follow-up and better communication with the client. This will allow adequate time for the clinician to spend time on the emergencies coming in and not to focus on finer discussions between clients and the vet. To implement both these models effectively, we had to increase staffing and training, and the training process had to be done in stages. Over the last decade, information connectivity technology, or what we call ICT, has evolved dramatically, and there will be more to come. The medical fraternity has embraced telemedicine with appropriate regulations and policies. Companion animal practitioners need to make the necessary change to improve productivity and customer interactions with the support of regulators, which otherwise won't be possible. Innovative practice management systems have incorporated ICT into their platforms, such as hospital database systems and hospital platforms, right? In Malaysia, for example, the poultry industry, and I'm sure in some other countries, like maybe in Thailand and Philippines, the poultry industry has been at the forefront of telehealth since the late 80s. The improvements in telemetry, patient monitoring tools, in herd health approach is equally applicable in a clinical setting, especially with the available ICT infrastructure. The livestock industry in Malaysia, however, has been analog for a long time and may need to adopt some of the global trends in disease surveillance and growth optimization, including, from what I've read recently, pasture management and maybe even estrus detection. In the companion animal sector, we have to learn from countries that have implemented telemedicine in urban and rural veterinary services. The integration would be in line with the One Health approach in disease surveillance and healthcare. In the urban setting, many practices are moving into hospital database systems with all the improved ICT integration. In Malaysia, teleradiology and even telepathology services are currently being implemented in stages. Finally, we need to acknowledge that clients have experienced telemedicine in healthcare during their own regular checkups and have liked it. And so being, it's only natural for them to expect the same for their pets. I would like to end my presentation today with a quote from a South African veterinary journal, which I read incidentally during the preparation of this presentation. It was prepared by Professor Garrett Bath, a respected educator in herd health, whom summarized telemedicine most eloquently. The conclusion is that telemedicine is not something abstruse and not only for the boffins. It's useful and simple to use even today. It can only get better as its use becomes widespread. With that, I would like to thank you once again for giving me this opportunity to share a perspective of telemedicine in Malaysia. Thank you, everyone.
Thank you very much to our speaker today. I think that all the information that we receive, from our invited speaker today is really very beneficial for us in terms of the telemedicine and also telehealth. Now it's time for panel discussion. And may I invite Professor Dr. Kaywalee Chatdarong, Dr. Teo Boon Han, and Dr. Amilan Sivagurunathan on stage. Yes, right now we are all together at this moment. And of course, before that, all the attendees who ask some question, if we cannot answer it all, don't worry. We will provide you the answer to your registered email address later on. But however, I think the most important that I think we have got a lot of information today, especially exactly the difference between the telehealth and also the telemedicine, which is different. But of course, the topic today is telemedicine, is right. So it's been something that we are talking about the subset of the telehealth, which is really concerned to the client, right? However, I think, shall we start for some question, because we have so many questions in the Q&A box. May I start with a question to Professor Kaywalee first, and then after that, all the speakers can discuss together. Of course, we have just recently endorsed for the veterinary telemedicine in Thailand, right? May I ask you that this is the telemedicine service in Thailand is popular or not? And for the Thai veterinarian, do they accept all the concept that you have already present to us today? Professor Kaywalee.
Yeah, thank you for the question. I have mentioned that the telemedicine, the announcement, the bylaw, the regulation has just been announced early, so we are quite early. But from the respondents to our questionnaires during we did the survey, the public hearing, there are some concerns that I have already mentioned about the physical examination. And as we follow the Human Medical Council regulation, they didn't even talk about the limitation in this issue. The physical examination of the animals, as Dr. Amilan also mentioned, Dr. Teo also mentioned that in veterinary, we cannot diagnose using verbal information from owners, because owners are not veterinarians and owners may have limited information about the clinical signs of the animals. What can help is that those variable monitor equipment, which I hope and I think the technology will be able to solve this problem. Am I what's is the
Yeah,
idea
yeah.
of the,
I can understand that it is very something that is so complicated and something we cannot just diagnose upon the verbal from the owner only, because they could not tell and everything that happened for the animal because they are not a vet and they can examine the physical examination as we have the so many protocol, right?
yeah,
But however, yeah, I would like to say that this is right now it is become to be popular and acceptable in Thailand among the vet practitioner for the telemedicine.
at the moment there are few applications and a few companies who establish this pathway, this platform.
Yeah,
So I think there must be the second, the third, the fourth versions of the system
yeah.
to try. Yeah.
Yeah, maybe it continuously because it's still developing, right? Yeah, thank you. Yes, and of course, I think it's come from this question because it's something that we have some kind of the evaluation or some framework that we should know what is going on and is this the right way that they treat the animal and as the practitioner. So in this case, I would like to ask Dr. Teo, your presentation is really very interesting indeed. I really like it. And I think this is something that we can use as a framework for evaluation or the assessment of how they do for the telehealth. I mean, in individual for the vet. I would like to ask you who will be the appropriate people or organization that use the framework that you already introduced to us?
Thank you so much, Professor, for your question.
Yeah.
Actually, the framework can be used by actually many people. It
Yeah.
can be used by associations, depending on who is driving this effort. It could be used by the regulators, the government, or even I was just having this conversation with some clinic owners recently. Even if there's no guidelines or regulations at this stage, like in Singapore, the clinic owner can actually use that framework to come up with their own company's position until there's some clarity on the regulations or guidelines. I will actually even go a step further to say, as an individual veterinarian, this framework, you could also use it to come up with your own individual position on telemedicine, when you will use it, when you will not. So actually, it's it's an all-encompassing framework that could be used by many people. But I think ultimately, the goal should be some sort of national guidelines or regulations for clarity, because as we can tell, many different people would approach this differently. And from industry's perspective, it's definitely good to have some national clarity and standards on the matter.
Yeah, it is very interesting because I'm thinking that it also worked for the VSP or council to use as some framework for when we have some kind of the complaint or something like that from the client to the vet, because this is upon the ethical committee should know that also. Yeah. It's very nice. Yeah. And of course, may I go to Dr. Amilan? I really especially the one that you talking about the opportunity, because right now we have some kind of the application that we can use, right, for the disease surveillance or some kind of the outbreak or something like that, because we just have only one smartphone and we go everywhere. And we know the situation of the disease. That is really the opportunity. I would like to ask you about you mentioned about the hospital database system as the telemedicine platform in your presentation. Could you please explain what is going on? I think it's really very useful for the veterinarian. that they can know how to use it, and it should be something can help for the telemedicine in the future.
Right. Hi, Prof. Dr. Acharya and the fellow members of the forum. So I think what is key here is there are a lot of applications currently available globally.
Yeah.
And I think some countries have established these platforms based on trial and error. But the advantage we have in the East is we can actually learn from some of what these people have done. And in fact, the platforms are quite variable, and also they can be influenced by the available connectivity that you have. So I think some countries are already in 5G, and some countries might still be developing the 5G network. So what you want is a system that is integrated with your local connectivity and probably has access to social media, WhatsApps and SMSs. And there has to be also some sort of team that can help you to integrate the systems, because in our experience, just starting off using it, we did realize that there were some teething challenges requiring people to fine-tune it as we evolve. But I guess in time to come, we hope that there'll be ready-made systems with a much better cloud application, stable to use, and gives maybe a less cost in terms of implementation and application.
Yeah,
Thank you.
it's really very nice. I think it should be something that the contribution to among, our ASEAN member state, it would be nice, for the clinic. Yeah. So may I come back to Professor Kaywalee? Yeah, I would like to ask you that right now you are really working very hard also together with this platform for the education. And of course, this is very, very nice for to use as some kind of the study tool for the student. In your opinion, do you think that it still work during the time that we use for online? But for the student, they need some kind of the skill or something that they have to touch the real animal or something like this. In this case, do you think that this is what kind of the disadvantage if it has when we use the telehealth for teaching the student?
I just can't see the disadvantage.
So you mean that everything is advantage, right?
Yeah, because I can see the opportunity, because the telemedicine, we will not use telemedicine or telehealth as the main platform for teaching, but we use it as a supporter, so it will support after hours learning for students. And as I mentioned, anywhere can learn. Why don't we give the opportunity for the student to learn after classes? They can access, for example, they may access a number of cases in the hospital, in the emergency unit. When I talk about this, some people object on the record information on the, and it said they must be prohibited because the medical record is not open to all. But you can arrange, you can authorize, and or under the teacher, the lecturer, the veterinarian authority. So I think we can manage.
Yeah.
And
Thank you. Yes, I can understand that, because this is some kind of it's just the supporting, because mainly, of course, the student should have the real case, but in case that this is very far and very difficult for transportation or traveling, it can help a lot for using the telehealth for teaching in the school. And the other thing that do you think that right now at this moment in Thailand, do you have any case that they complain to the veterinarian, to the Veterinary Council of Thailand about the veterinarian use the telemedicine treatment the animal? Do they have some complaint like
No,
this
I haven't heard about
so
this yet
far?
so far.
Okay,
But
yeah.
we'll see. We'll see.
So I think because right now we still in the COVID period, right? So everything they are thinking that it can be make it convenient. So maybe they don't think that they would like to complain with anymore because it can help already for telemedicine, right? Yeah. Okay. Yeah. Thank you. Yes. I'm going to Dr. Teo. The other thing that right now, I really impressed the one that you are talking about in the rural area, and of course, some kind the livestock, especially like the cow that you show that is they are really far, and sometimes they lack of veterinarian to take care because it's really a remote area for the telehealth can help. But of course, it increasingly right now for the pet is also coming together in the picture. And do you think that in Singapore, what are the potential challenge of the 4C pet wearable coming into the pictures of the telemedicine?
No, thanks for your question, Professor. For the pet wearables, I think an important point about pet wearables is actually that we have to be a bit mindful, I guess, on what the pet wearable and whether the instrument or the equipment has been validated properly. I think that's first and foremost. I think perhaps some pet wearable companies, especially if they're new companies, they may think it's quite easy to, if they're manufacturing human wearables to manufacture pet wearables, but it's a bit more complicated. And from a marketing angle as well, they may be a bit more liberal in certain claims that what their wearables can do. But I think as veterinarians, as with all services and products and equipment that we use, we just have to be mindful that they have been validated thoroughly, and that we have confidence in the equipment that we're using. I think that's a big challenge. I think so far, at least to my knowledge, I've not seen one that has been really thoroughly validated to that extent. So if the pet owner thinks, it's high sensitivity, high specificity monitoring equipment, but it's actually not, that's actually a big danger to the pet for the health and welfare of the individual patient. So I think that's an important point that we need to look at.
Yeah. Okay. Thank you very much. It's really should come in mind that we should think about that. Yes, I think I will go for the last question to Dr. Amilan, and I very impressed. And I think it is really go from, this word is a VCPR. It's really come from all our speakers. Could you please again emphasize for VCPR to our attendee today, because I really think that it is some kind of the responsibility and ethic of the veterinarian who work in the veterinary telemedicine. Yes, please.
Right. Thank you, Prof. Achariya. So I think with VCPR, knowing that we have this distance interface now between the physical client and the vet, so I think the first step is to ensure that we help pet owners. The whole objective is to ensure we help pet owners to make good and safe decisions for their pet, and to ensure we can address them in a safe and effective way. So for that to happen, we need to be very clear about the knowledge on the subject matter. And so the telemedicine is not something that you can delegate and do it in a sort of a casual way. Secondly, we have to ensure that the information relayed is clearly recorded and there's clear messaging in terms of the disease and the condition. And it generally works much better when there has been some prior investigation on the pet. Of course, if you have never met a pet before, for example, in the case of an emergency, this is one of the rare exceptions where teletriage actually benefits from the telehealth system, where we help clients make the right advice based on the situation. However, you've never seen this pet before. But there again, you are not making a diagnosis. I think like Prof. Kaywalee had mentioned earlier,
Yeah.
we must be careful not to make a diagnosis, not to prescribe, and to ensure that the safety of the pet and the welfare of the animal is taken into consideration.
Yeah. Thank you very much for a very nice conclusion. And I think this should be keep in mind for the veterinarian who work on the veterinary telemedicine. Thank you very much. When we are talking about a very interesting topic, the time is really going very fast, and already the time is finished for today. Yeah, all the attendees, I really would like to give the closing remarks, and thank you very much to all the attendees, ladies and gentlemen. It has been an honor for me to host the webinar on the veterinary telemedicine in ASEAN, challenge and opportunity, which will be valuable for all but attendees in the future of these latest innovation that can potentially be a game change in the fight against the global COVID pandemic. On behalf of the Federation of the ASEAN Veterinary Association, FAVA, I would like to express our sincerest gratitude to Dr. Quaza Nizammuddin bin Hassan Nizam, FAVA President, on his honorable opening address, and all the invited speakers, Professor Dr. Kaywalee Chatdarong, the Chair of College of Veterinary Specialists of Thailand and Veterinary Council of Thailand, Dr. Teo Boon Han, a managing partner and veterinary consultant at VetTrust Singapore, the Honorary Secretary of the Singapore Veterinary Association and Secretary of FAVA Veterinary Education Subcommittee, Dr. Amilan Sivagurunathan, representative of the Malaysian Veterinary Medical Association, Malaysia, and Pet Fair Southeast Asia team from VMU Exhibition Asia Pacific on jointly organized this webinar with a great success. Lastly, FAVA is delighted to invite you to attend the 21st FAVA Congress, One Health Approach from Asia, during 11 to 13 November 2022 in Fukuoka, Japan. For more information, please visit the Congress website, worldwideweb.fava22.com. Thank you very much for your participation and see you again. สวัสดีค่ะ